Good evening, you're watching To The Point. I'm Preeti Chaudhary. We are going to begin with the latest news break figures that are coming in on corona active cases in the country. Well, this is the latest that has been released by the ICMR, and right now corona active cases in the country stand at 633. Now, this is in addition to a whopping 90 new cases that were recorded positive in Kerala. 4 coronavirus deaths have been reported now in the country in the last 24 hours, taking the total to 16 in the country. There have been 16 deaths where coronavirus is concerned in the country. 45, and it's important to reiterate, 45 coronavirus patients have so far recovered, cured. The entire, once again, the number is 633 of coronavirus active positive cases. 4 coronavirus deaths reported just in the last 24 hours. The number has shot up because one of the main reasons is a sudden burst of positive numbers being reported from Kerala. We've had 19 corona positive cases being reported from Kerala today, which has taken the number, like I said, to 633. Now, before we break this news, I would like to tell our viewers that this is just precautionary. The army is on standby, ready for civil medical aid to deal with Covid-19. With number of coronavirus positive cases rising, the Indian Army is on a war footing to set up more quarantine centers for their own personnel and also extend its medical infrastructure for civilians. The army is prepared to extend its network of hospitals, its laboratories to assist the civil administration. But one has to reiterate that this is only precautionary. There is no need for the army to step in right now, but the army is prepared to step in. All right, so let's move on. We talked right in the beginning of To The Point on the import of numbers. What India is looking at right now is 633 active corona positive cases. I want now to take our viewers to look at where India actually stands globally. Globally, India has been the first country ever to announce a lockdown at just 500 cases. We went into a complete lockdown at 500 cases. Even China didn't do that. Do we have an advantage? Where do we stand on the global scale? What has been the rise in each state, let's say since March 1st or March 10th to March 26th? This is the full report that I filed. Look at it. Locked down, locked in, as a country of 1.3 billion literally shuts down, hoping to tide the world's biggest health emergency with minimum fatalities. This is where India stands globally on the coronavirus curve, in number of positive cases when each country imposed a lockdown. India imposed a lockdown with 500 cases, quicker than any country, even China. What India has going for it, the lockdown has been imposed much earlier than many countries. Travel restrictions came in well in time compared to other countries. Many states individually shut off access to public spaces on their own.
If India does the same thing, breaks down the problem, puts in place the measures that are needed, both surveillance and healthcare measures, and does that systematically, then there is a way out. There is a transition from lockdowns into a public health driven response in which people don't have to stay locked in their homes for more time than is absolutely necessary.
The real test for India in its fight against Covid-19 has just begun. Officially in stage 2, called local transmission, the country is standing on the precipice of stage 3, community transfer. From 10th March to the 26th March, this has been India's corona curve. India had 54 cases on March 10th, which have risen to 656 cases on March 26th. State-wise, in just a fortnight, the rise in cases could be deemed alarming. Karnataka, from 4, has touched 55. Rajasthan jumped from 3 cases recorded on March 10th to 40 corona positive cases on 26th March. Delhi has risen from 5 cases on the 10th March to 36 cases on the 26th March. Kerala has seen a huge surge from 11 cases on March 10th to 118 on March 26th. Gujarat had no cases, 0 cases on March 10th, and now stands at 43. Maharashtra jumped from 2 to 125 cases in just about a fortnight. And these are numbers recorded when India is being criticized for limited testing. The corona battle starts now, India. Will India flatten the curve? Bureau Report, India Today. All right, so where is India poised right now? Where is India standing on the corona curve? We showed you state-wise on how certain states have actually seen an exponential rise. Where the numbers in India are concerned, we had just 5 corona positive cases on the 10th of March. We are standing right now at 633. So in about a fortnight, we have recorded over 628 cases. Well, joining me right now is Dr. David Nabarro. He's the WHO Special Envoy for Covid-19. Appreciate you for joining us, Dr. Nabarro. My first question, now India has announced a complete lockdown. It was the first country to actually go into lockdown with just 500 cases. Now, do you think we did it at the right time? Or do you think as a country with India, with a population of 1.3 billion, it was a tad bit late?
I want to stress that as far as we understand, the transmission in India is at a much earlier stage than it is in Europe and the US. I think it's great that decisive action has been taken in line with the recommendations of the World Health Organization by the government and people of India. But I do want to stress you have to have, as well as the lockdown, very good quality community level public health services. You have to also protect your health workers as much as possible. The lockdown alone will be important, but you need the other pieces of the comprehensive response as well.
Dr. Nabarro, now India had 5 cases around the 1st of March. By the 10th of March, we had about 11 cases. Today, Dr. Nabarro, we stand at 633 cases. Now, you've mentioned before the speed of the pandemic is thought to be doubling in size at about 2.5 days. Now, it increases 8-fold in a week, 250-fold in 3 weeks, and of course, 1,000-fold with what you said in 4 weeks. As I said, we have over 600 cases. We have reported 16 deaths already. We've seen 4 deaths in the last 24 hours. At which stage do you think India stands now?
I think that there will be increases in India as in other countries. But the fact that the government took very rapid action, given the stage of the outbreak in India, and the fact that you have all of society working to try to make sure you've got this community preparedness makes me feel more optimistic than if India had waited a further week or 2. It's this speed of increase that's the worrying feature of this particular outbreak, and the need for very decisive and firm action right at the beginning. And I believe that what India has done is in line with what the World Health Organization wants, provided we recognize that it's several elements. It's restricting the degree to which people have opportunities to be close to each other, and at the same time having a strong community-based public health service to back it up, together with hospitals ready to receive cases and staff as protected as possible so they don't get the disease.
You know, Dr. Nabarro, WHO recently said that India's swiftness will decide the world's future. In that sense, India seems to have become a critical player.
India is absolutely critical given the size of your population and also the fact that you have a really well-developed public health service right throughout the country, with community level workers who are well able to work with people in order to try to reduce disease. I believe it is in the capacity of the people of India to bring this rapid rise quickly to a reduction and then to a halt, so that the outbreaks are contained and then suppressed in your country. But it will require efforts by every single citizen. What we've learned is that if there are disputes between different administrations, or if there are uncertainties about what to do, then the virus finds its way in and causes all sorts of trouble. So this very clear direction and a very good uptake of the guidance all over the country is really excellent, but please keep it up. Don't let up. Maintain the control strategies you have in place, until you are 100% confident that you're able to protect the citizens against this virus. Because even if you get the current outbreak and pandemic down, this virus will still be with us, and we need to be on guard and defending ourselves with high alert for the foreseeable future.
All right. Dr. Nabarro, there is a sense in the country where officially we are standing at stage 2, which is local transmission, but we are closely watching certain clusters to see and gauge whether we are already unofficially in stage 3, which is community transmission. Now, I want to ask you, can we contain the virus before we actually get into stage 3? Or do you think in a country like India that's inevitable, it's bound to happen, but we need to control that?
And this is the key point. We're asking citizens everywhere to change the way in which they behave. We're asking public health services everywhere to be on high alert. We're asking hospitals to get ready, even when there may not be much virus moving in the community. And that's the right thing to do, because the sooner you can get on top of these outbreaks and contain them and then suppress the transmission of the virus, the less likely you are to end up with an explosive situation like we have in parts of Europe, very close to where I am in Geneva, Switzerland right now. Act early, act robustly, act without regrets, and that can greatly reduce the magnitude of the problem that you will face later. I know it's a sacrifice, I know it's a struggle, but it's so important to do the actions now rather than to not be so comprehensive and then some days or even weeks later then scratching your head and say, why on earth didn't we do it quickly? This is the challenge faced in much of Europe right now. Leaders are saying, well, perhaps we should have acted earlier. But now I think India can learn from the Europe example, can also learn from China and South Korea, and really show the world how you can keep a huge population safe in the face of this threat.
Appreciate you joining us, Dr. Nabarro. Thank you so much for taking out the time. I want to now cut across to a crack team of Indian doctors who've been studying the pandemic very closely in India. I have Dr. Sanjeev Bagai, he's the chairman, Nephron Clinics and Padma Shri Awardee. I also have Dr. Rajesh M. Pavlik, he's a director, medical research and neuropsychiatrist, Jaslok Hospital. Let me begin with you, Dr. Bagai. With what we just heard Dr. Nabarro say, eventually when you asked him about community spread, stage 3, he seems to suggest that it is inevitable, but it is for us to actually contain that cluster break. Because even let's look at what's happening in certain areas. If you look at, say, Hyderabad and Telangana, Hyderabad is recording more than 50% of what Telangana is recording. Bhilwara is recording more than 50% of what Rajasthan is recording. If you look at these clusters, Kasargod recording pretty much, quite a big chunk of what Kerala is recording.
Good evening. I think the distribution pan-India will be in different hotspots. So you may find certain states and certain areas where the infection has spread and then further percolated down from person to person, varying from region to region. So the initial stage was of containment, which we are still persisting with. Then is, of course, mitigation and then suppression. Now, suppression means lockdown. So I think this was an appropriate step at an appropriate time. There'll be a lot of patients who are asymptomatic carriers who would have perhaps transmitted it into the community. So the contact tracing still has to continue. Every report worldwide has shown with lockdown, you have to continue to do the public health surveillance. So I think India is doing both. It's early days in the 21 days. But I think this is just the beginning of our fight against corona. Hopefully we should be able to have much lesser numbers than many other countries in terms of mortality and morbidity.
All right, well, let's hope that happens. Dr. Parak, would you want to add to that? And the question I want to ask you is stage 3 inevitable for India right now?
Possibly. But let me just add on to what Dr. Nabarro said. By the way, he spoke like a true public official, like a leader. He infused optimism in all of us. And the graph that I have with me today illustrates, in some ways, his optimism. So you see three graphs over here. You see the Italian graph, you see the Chinese graph. I'm sorry, you see four. Actually, two graphs are kind of merging into each other. You see the South Korean graph and you see the Indian graph. The Indian graph is in blue. It's crawling right below. I'm getting this closer to the screen. Is this clear?
Yes, yes. It's better, Dr. Parekh, yes.
Okay, so the substantial portion of Dr. Nabarro's highly motivational speech that we're doing well, we have every reason to feel great, is borne out by this graph. But sometimes we also need to look between the lines and between the numbers. Now, here is the cause for concern. Look at the rates at which the numbers are doubling and have doubled in other countries. So if you see that in Italy, it took the last 5 days for the numbers to double. In China, the numbers doubled in the last 39 days. In South Korea, the increase was 2.1 times, in the last 14 days. And in India, if you look at the last number here, it's been 2.3 times in the last 3 days. Now, there was a sentence encrypted in Dr. Nabarro's motivational address. I'm not sure whether it was intentional or not, but there were 4 words that caught my ear at least. And he said the tremendous spread of disease. So there are 2 things you look at. You look at the extent of the disease and you look at the rate of change, the rate at which it is going up. He did express some concern about it. So while we need to be proud of the way our government has acted, while we need to support all the actions the government has taken, but let us not be lulled into a false sense of security. And of course, in all fairness, he did emphasize that towards the end. There is an issue of concern. The rate of increase, as you yourself pointed out, is an issue of concern. And please keep in mind, we've just started with our testing program.
Right.
The more we test, the more positive cases we're going to get.
And it's happening, right. And Dr. Parekh and Dr. Bagai, I'll bring you in on this because, Dr. Parekh has a point. The more we test, the more numbers are coming in, and they are. Of all the states, Kerala is the maximum testing state right now. And today, they've thrown up a number of 19 already, 19 positive cases in just about a day. But the rise, which, Mr. Parekh is saying that we have to be very, very cautious about and we have to watch very, closely. Let's just look at, Dr. Bagai, the state of Gujarat. On the 11th of, or the 10th of March, it had 0 cases. It's already over 30. We've had cases practically doubling in Kerala. Maharashtra is seeing similar cases. So is that a huge cause for concern, or do you think that is possibly the trajectory of the epidemic in India, and hopefully we'll flatten the curve?
Yeah, I think this is the normal progression of a pandemic, and indeed this pandemic, in which a lot of the infection would already have been there from person to person. So more we test, more top line numbers we'll get as the total number of positive cases diagnosed with COVID-19. But the more important thing is if we can continue the testing, continue the contact tracing. I think the contact tracing is a very difficult job, but the most important thing to do as far as public health surveillance is concerned. And in the lower end, if we can keep the mortality at the least, I think then we will win this war against COVID. So it's just initial few days of the 3 weeks period. We cannot be complacent and we can't be lax. So all our combined efforts we have to continue to do. We also have to keep in mind to build up a contingency which the government is doing. In case there is a deluge and avalanche of patients, how do we manage them at that stage? So I'm sure there will be multiple factors working together at the same time in government agencies to keep all plans ready and use in place.
All right, Dr. Parekh, very quickly, I want you to encapsulate what from here on right now, because we are looking at an exponential rise. Do you actually share the optimism of Dr. Bagai, or do you think we need to be way more cautious right now because just the kind of numbers, the import of numbers that is being thrown at us?
Well, without sitting on the fence, we really need to have cautious optimism. We need optimism to support all the brave people on the front line who are putting their lives at risk. We need to support our government. It's not an easy decision for them to make. It's a series of very tough decisions that they're going to make. But we also need to be cautious. And if I may share one more graph with you, which is the optimism part of it, very, very optimistic part of it. Again, we have the same color scheme. You see China, you see what happened in Korea, you see what happened in Italy, and you see what happened in India. Now, these colors represent the points at which lockdowns occurred. So China, very early in lockdown, and then the rate is going down. This peak might appear like an aberration, but there is a reason for it. China earlier was underdiagnosing patients for whatever reason they had. And when the WHO pointed it out, they changed their criteria. And so this spike is actually due to a change in criteria of making a diagnosis. And here is what you see India has done. Here is what you see Italy. Italy came late into the act. We've come in much before at an earlier stage.
We've come in at 500, Italy came at 5,000.
Okay, but there's something else again, and we need to learn to read between the lines. Here's South Korea. And what South Korea did not get into lockdown. Of course, it's a small country, its geography, its demographics are very different from ours, but they managed to contain this by testing.
Right.
Now, to understand the progression, Dr. Bagai used a phrase, normal progression.
Right.
It's important to qualify that. By normal progression, do we mean the way the disease progresses on its own? And I assume that's what he's alluding to. Or do we, by normal progression, mean what the disease does with our efforts?
Okay,
now,
all
Dr. Neil Ferguson, who's an authority at the Imperial College in London, stunned the Western world about maybe 8 days ago when he made his projections, and they were 500,000 deaths in the UK, 2.5 million deaths in the US at normal progression without doing anything.
Okay.
This shook up both governments and the US, which was lagging way behind
I need to end the show, but appreciate you joining us and giving us those figures, and appreciate you joining us, Dr. Bagai. We're going to come back to you tomorrow once again. But I want to just end the show on the fact of how we need to be cautiously positive. We are in stage 2. Officially, we are in stage 2, that is local transmission. But our country and our health officials are rightly watching certain cities, certain districts very closely, which possibly could be close to a cluster outbreak, but nothing till now of such has been reported. But let's look at all the hotbeds of the coronavirus right now. We end the show on that. Appreciate you all for joining us. 649, the total active corona positive cases in India. India officially now in stage 2 of the corona transmission called local transmission. The country is staring at stage 3, community transmission, cluster outbreaks. As cases continue to register, medical authorities in India will be closely watching these centers. Bhilwara in Rajasthan, Hyderabad, Telangana, Kasargod, Kerala, Pune, Mumbai, Maharashtra. Bhilwara city has become a corona flashpoint for the administration, with 18 cases reported, including 1 dead. 16 medical professionals have tested positive and over 8,000 are in self-isolation. The city is feared to be standing at the precipice of community transfer.
अभी हम लोकल ट्रांसमिशन की स्टेज में हैं, जबकि हम पर्टिकुलर केस के साथ उस केस ने किसको इन्फेक्ट किया, जैसे आपने भीलवाड़ा का एग्जांपल दिया, तो एक डॉक्टर थे जिनकी ट्रैवल हिस्ट्री थी, उसके बाद उन्होंने अपने जब हॉस्पिटल में काम किया तो उसके साथ कुछ और लोग इन्फेक्ट हुए। अब इसी के साथ ही पूरे देश में अगर 500-600 केस अगर हमारे पास आज हैं और हम उनकी कॉन्टैक्ट ट्रेसिंग करते हैं, तो 1 या 2 केस में अगर हमें उनके कॉन्टैक्ट नहीं मिलते हैं तो ये नहीं माना जाता कि वो कम्युनिटी ट्रांसमिशन शुरू हो गया।
The corona epicenter in Telangana with its 44 cases is Hyderabad. Hyderabad has recorded 28 of the 44 positive corona cases. Many have no travel history, but just of traveling to Delhi.
उनको सही में उनका कोई कांटेक्ट नहीं होगा, ये मैं नहीं कह रहा हूँ, लेकिन आप जो 1-2 केसेस की जो एनेक्डोट्स कोट करते हैं, और उसके ऊपर जो आप अंदाज बांध रहे हैं कि कम्युनिटी में ट्रांसमिशन शुरू हो गया होगा, वो शायद उसके लिए इतना एविडेंस ठोस नहीं है अभी भी, और अगर रहता था तो हम क्यों नहीं बोलते थे।
Which leads us to Delhi. The national capital has recorded 36 active cases. The most worrisome is the doctor who has tested positive in a mohalla clinic after seeing a patient who returned from Saudi Arabia. Now 900 people who are in primary and secondary contact with the doctor are in isolation. The other centre to watch out for is Kasaragod in Kerala, recording 45 of the total 118 corona positive cases in Kerala. And lastly, Maharashtra, with maximum number of cases registered in the country at 125. Pune and Mumbai are being closely watched for community spread. Bureau Report, India Today.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.